My name is Dr. Jim Powell, chiropractor here in Canton, Ohio.
And I'm Dr. Chip Null, also a chiropractor here in Canton.
We'd like to welcome you to Before the Scalpel. We have a unique program here at Powell Chiropractic Clinic, the only clinic in the United States with this exact program, and we have a 90% success rate.
And we call it spinal decompression therapy, also known as the Disc-covery program here at Powell. Welcome.
Welcome. Welcome back, episode 5, not just another adjustment. Why we are different.
Well, I think we're unique in a lot of ways, as we talked about in the previous episode.
Right.
We're not just chiropractors. We are, we treat the discs, I think, a little more specifically than what other chiropractors would.
Right.
Because of our decompression machine, we have that ability. Not saying that others don't.
Right.
But the machine we have is very highly technical, and I believe the one that we have is the best one on the market.
Right.
So,
Before the Scalpel and why this is different is this podcast.
Yeah.
And there's nothing wrong with getting adjustments of the spine, and we highly encourage it whether you come here or you go to another chiropractor. But if you're not getting the results that you're looking for, that doesn't mean chiropractic doesn't have value. It means that you need more than an adjustment. You need
Correct.
more than a treatment.
Yep.
So when you come here, you get a program, a process, a proven process with a 90% success rate.
and part of that program, of course, is adjusting the spine, like
Right.
other chiropractors do, but I think we take it a step further, not just in our exam process and taking x-rays and going through a thorough neurological exam, which other chiropractors do too. I'm not saying that they don't.
Right.
But we take it to the next level, so if you do have a disc problem or a significant nerve problem, we have the tools here to help you with that.
Right.
You know, especially when you mentioned if regular adjustments don't seem to be long-lasting.
Not
I guess
resolving.
is the best way. Yeah,
Yeah.
not resolving. Correct.
So you'd mentioned in a previous episode where physician means teacher.
Yes.
So the x-rays that we take, we have line markings on the x-rays. So they're very clear pictures that you can see the bones.
Yes.
You have established normals of what position, what angle, what degree, if the head's forward, how many millimeters. Very, very precise.
Yes.
So we teach you about your body. Then the process or the program, even though it sounds very general, each aspect is very specifically designed for you.
Absolutely. And to go off that, the initial x-rays we take, like you say, we compare them to normal. Once the program's completed, we retake those same x-rays again, and then we compare before and after, and you can see significant change. It's
What's
great.
unique is that when
Yeah.
you see the changes.
Right.
So even though you're not a radiologist and haven't studied how to read an x-ray,
Yeah,
our education process teaches you what to look for.
that's right.
So then you have your pre and your post. Everything that we do here, every aspect is pre and post.
Yep.
Then we monitor you along the way.
Yep, very specifically. And you know, sometimes along the way, things maybe aren't as working as well as they had once had, and so we change gears.
Right.
And whether that is we have to re-examine and figure out, is there something different we need to do?
Right.
Or maybe take a totally different, or maybe even a referral.
Yep.
In a referral between ourselves to say, you know, Dr. Jim has a really good soft tissue method here that I think would help, so I'm going to have you he's going to take a look at you and add that to our program.
So just as a patient that you'll remember, Carrie,
Yes.
not responding to our disc recovery program.
Yes.
And he had been treated maybe 4, 5, 6 times. And I had just taken a call with a neurologist out of Arizona, and he had said the hyperbaric chamber that we use for our neurology program,
Yes.
he said if you have a sprained ankle or a hot disc, and he went on to a lot of other diagnoses,
Yes.
he said put him in the hyperbaric chamber with concentrated oxygen.
Yeah.
Never in a million years have I thought of putting a hot disc in a hyperbaric chamber.
Right.
We did it. We did 2 of those with Carrie with significant improvement in pain.
That's right.
It was bizarre,
Yeah.
but that's the uniqueness. We try to change gears with each patient depending on what we find.
And I think it's a testimony to the number of different treatment options that we've built up over the years for cases like that.
Right.
And referencing again Dr. Powell and
Yeah.
some of his health ailments. And we're getting to the point where sometimes we have some issues as well.
Getting older.
Yeah. So
It happens.
we're getting seasoned for that. But
Fine
anyways,
wine.
yeah. So, but we're our own test cases.
Right.
And so what we find to be beneficial, we pass on to other patients. Not only that, but we also piggyback off how other patients do.
Exactly.
Our patients, basically, I remember when I was in school, they said, if you ask the right questions, the patient not only will give you the answers you need, but they'll also tell you how to fix them.
They'll direct the treatment.
Yeah.
Yeah.
So you just got to listen.
There's a reason that medical and chiropractic practices are called practice.
Yes.
Practice to make perfect.
Yeah.
So the care that was delivered when you graduated from chiropractic college and I graduated from chiropractic college was beneficial, but the care that's being delivered now after 25 and 30 years of practice,
That's right.
significantly different now than it was then.
Yeah. And it's been a nice evolution, to
Yeah.
say the least. So.
In each case, that's especially the complicated ones,
Oh, I know.
they teach us,
That's right.
and then the next one that comes with the same symptom, it worked for the other patient,
That's
more
right.
likely than not, it's going to work for them.
Yeah. Well, and Carrie is a good example of that
Yeah.
that you mentioned earlier with the hyperbaric chamber. So, yeah.
So in the process that we do, we really try to understand what the patient's goals are.
Yes.
So if your goal is to golf, or if your goal is to return to a specific sport, or lift your grandkids, knowing what your goals are, and we'll do everything in our power to get you back
Yes.
to your goals.
To try to get that accomplished. And how gratifying it is when we're able to do that.
Yeah,
And we were mentioning earlier the emotional and psychological component of care. That's kind of where that falls into place, especially when you're talking about somebody that says, I want to be able to stand in the kitchen
Right.
and prepare dinner and not, have to sit down because I'm hurting so bad I want to cry.
right,
But I don't want anybody else to know, and you push through it.
right.
Or, like you say, pick up grandkids. I mean, what grandparent, when a grandchild comes to you and wants picked up, you're going to do it.
Yeah,
But inside, it's tearing you apart.
Right.
And you may get to the point where you can't do that, and it has tons of implications. So,
on a side note, if a goal that you're looking for is not something that you've ever done, that's not a good goal. So if you
Yeah.
can't play the piano
Yeah.
and you want to come here for care and
Yeah.
you want to be able to play the piano, that's a bad goal. So you have to be really clear on what your goals are.
well, we always joke. I get people that say, if this decompression, is it going to make me taller?
Oh my gosh.
I'm like, well, it will, but I don't know if you'll significantly notice it. It's not like you're going to be 3 inches taller and people are going to be like, what are you doing?
I was about a year in practice. It's on a Saturday. We used to work Saturdays.
Yes.
I got a call from a kid that said he's getting married next weekend and he doesn't fit into his tux. Can I stretch him to make him taller so he could fit in
Yeah.
his tux? And I was like, that's the most interesting
Yes.
request I've ever had.
How did that go?
I didn't take him as a patient.
Yeah.
So, yeah.
Well, what you will find, though, truthfully, we do get increases in the disc space,
Yes.
so it does allow for an increase in height, literally.
They do, yeah.
And we see curves, so when a spine should be straight, sometimes it bends.
Yeah.
And so a lot of times when we do the post x-rays, that bend will decrease, if not disappear, with
Right.
decompression. So it does happen.
Interestingly enough, because of the success that we've had with the decompression table, specifically on those lateral curves, a
Yes.
lateral curve of the spine is scoliosis.
Yes, that's
That'll
correct.
be another one of our podcast opportunities for people to understand what that is.
Yeah.
But if the spine's sideways, it's supposed to be straight, and you elongate the spine, very commonly you change those curves.
Yes.
So in our scoliosis program, we use the disc recovery table, the DRX 9000,
Absolutely.
in that program because it literally does, it's called Y-axis traction, back
That's right.
from geometry class.
Yeah.
Y is up and down, X is right and left, Z is front and back.
Yeah.
All three of those dimensions matter. So we do that on X-ray and we do that on analysis so we can see where are you, and pre and post. We do pre and post X-rays, pre and post exam findings, pre and post strength testing, all of that?
Well, what's interesting is we have a lot of patients that we may have seen many years ago.
Yeah.
And they end up returning. We call them a PPR. It's our term in-house for a previous patient returning.
Right.
They come back in and we take x-rays to update where they're at, and then many times we have x-rays from years back that we compare, and you'll see curves like you're talking about. And with the treatment possibilities we have now, we can make changes on that where we didn't really have the changes, or the treatments that would change that now. And even the patients will say, I forgot about this curve. How come we weren't able to treat it then? Well, because we didn't have the knowledge or the treatment options that we have now. So again, it's part of that growing process and all the years that we've been in practice. And I love how you mentioned earlier, it's called practice. We don't get it right all the time. We don't always have the options. And so, we're practicing along the way, trying to perfect this wonderful profession that we're in.
And in a future episode, we also were going to explain when we find a patient that after all of our experience and all of our exam findings, we recognize that they may not be a great candidate for this program, we don't accept them.
No.
So the ones that are accepted have a very high success rate.
Most definitely.
Because we're selective. Not everybody is a good candidate.
No. And as you mentioned earlier, we have very qualified doctors, orthopedic docs that we send to that we trust, and we know we'll take very good care of them for those few cases that we can't help or can't improve to the degree that we want them or that they want them to be. So.
And those guys also recognize us.
Right.
So
correct.
One of the surgeons in town, good friend of mine, sent me his dad for care because he knew that his dad needed chiropractic care. So they're becoming more educated on what we do. We're educated on what is it that they do, and it makes for a nice referral aspect so that the patient gets the very best care. It's not always just about the doctor.
That's right.
Or the clinic.
Yeah. Well, as much as we know orthopedic, we also know very good physical therapists.
Correct.
So physical therapy, physical meaning muscle and movement, treating muscles, we coexist with a lot of great ones on that too.
Right, and their patients too.
Right.
Which is unique.
And massage.
Yep.
Soft tissue, we have a lot of that. So, I mean, care is it's a team approach.
Right.
Not just within our own clinic, but with all the people in our area that we really work well with, naturally.
We refer to acupuncturists
Yes, sir.
as well, and that has great value for some folks too.
Mm-hmm. Yeah, so we try to treat the whole patient, and of course the nutritional aspect.
Correct.
So that's a good thing.
Right. So there's a patient testimonial that we're going to cut to where one of the things that they said is, I've tried everything, so why not give this a shot? So we were like the last ditch effort before surgery and had tremendous success. So watch this video.
Yep.
I was having immense left side neck pain. I couldn't turn my head to the left, and I had immense swelling on that side, and I knew something was seriously wrong. I'm in healthcare, and I refused to have surgery on my spine, and I knew that was one of the first things that they would suggest, because I knew it was bad. And from the moment I walked in, the staff was phenomenal as far as putting me at ease. I met with Dr. Null. We did head-to-toe x-rays, pinpointed the problem. He made a great game plan, and we went from there. I did about 6 to 8 weeks, twice a week with decompression, adjustments, physical therapy, and it was absolutely amazing the way I felt afterwards. I can now turn my head to the left. I have almost zero pain, and it doesn't hurt at all. I put my earbuds in, played some music, did whatever, and within no time, within your half an hour, you're done. I could feel the movement. And as I was doing with physical therapy upstairs, I was like, oh my gosh, I'm not in pain anymore. I'm not in pain. Because I was in severe pain for so long and didn't realize how bad it was. I'd travel anywhere. I mean, you can't put a price on that. And I'd pay any amount of money, because you can't. Because I have my life back now. I've always been crippled with back pain. I have it back. I have my life back. I mean, it's incredible. I was in a car accident. I was in high school, and I've dealt with back pain my entire life. I don't have it anymore. I don't have it. I feel like I'm in my 20s again.
Okay, Wow, what a great story that was.
Cool.
I mean, Lori, you know, a patient
Amazing.
of mine is a nurse, and what a great recovery. And for her to be in the medical field, to come to chiropractic wasn't easy.
Right.
And the fact that she was in such pain, she was scared to death for me to even touch her neck.
Right.
And now she's my biggest supporter. So,
That's right.
yeah.
A lot of our nurses that come, they're not quite sure what we do,
That's right.
but they are sure that they don't want drugs and surgery.
Yes.
So because they're in that environment
That's right.
and they see the negative aspects. There are positives. I'm not saying everything about medicine is negative. I certainly don't want to imply that.
Not at all.
But if you can do treatment that's not surgical, not medication, try that first.
Most definitely. And I think that's just a natural desire to try something like that. When any of us would be in pain, we'd want to take the path of least resistance.
Correct.
Okay, anything natural, and it makes sense.
Yep.
It makes sense. So yeah.
Very cool.
Yeah.
Cool. So our next episode is episode 6, Test, Don't Guess. So look forward to sharing that information with you shortly.
Powell Chiropractic Clinic introduces Disc-covery, the alternative to back surgery. The advanced Disc-covery protocols created in 2006 by the doctors at Powell Chiropractic Clinic are healthy and effective ways to avoid surgery and relieve pain. Innovators in chiropractic care, Dr. Jim Powell and Dr. Walter Null invite you to live pain-free, drug-free. Call today for a free no-cost consultation and preliminary examination. Powell Chiropractic Clinic, located on Munson Street Northwest in Belden Village and at powellchiropractic.com.